Chapter 61, Communication in the Dental Office. Good communication in all forms is the backbone of a well-run organization. Learning about interpersonal communication allows you to communicate what you mean and to interpret what other people say and do correctly. Communication pathways. There are two parts of any message, the statement proper and the explanation. Verbal communication, words or spoken or written, and non-verbal communication, including body language, posture, movement, and attitude. Listening skills. Don't let your mind wander. Put aside personal concerns while the patient is talking. Don't concentrate on formulating a reply. Concentrate on what the patient is actually saying. Look as well as listen. Pick up both the verbal and nonverbal information the patient is transmitting. Don't stereotype. Avoid selective hearing and avoid impatience. Understanding human behavior. A collection of actions performed by human beings who have been influenced by a person's culture, attitudes, emotions, values, ethics, and authority. Socialization, the process by which society influences individuals. Peer pressure, conforming to the general behavior of a group to feel more accepted in the group. This can be positive or negative. Cultural diversity. Differences must be understood in gender, race, cultural heritage, age, physical abilities, and spiritual belief. Recognize varied verbal and nonverbal language amongst cultures. Communicating with colleagues. Working in a positive, challenging, and stress-free environment is what everyone wants from their place of employment. The one key to a successful work environment is teamwork. Being a team member could include being flexible and receptive to altering the way responsibilities are performed, being self-confident and use self-initiative when it's time to get things done, show appreciation to coworkers, think before speaking, do not let your emotions get overly involved. Remember that the first impression is not always the right one. Share the ups and downs of the day. Your way may not always be the right way. Stress in the dental office can come from lack of staff, appointment overbooking, multiple tasks required simultaneously, lack of good communication, and perceived lack of job advancement. Conflict among coworkers. If difference or conflict among colleagues are creating stress, learn how to work through differences by engaging in team building dialogue. Communicating with patients. Effective communication is important in achieving patient satisfaction. Patients who have good relationships with their dentist and the dental staff are likely to stay with the practice, accept treatment, pay for their treatment on time, and refer patients to the practice. Patients base their perceptions on how they're treated on the phone, how they're greeted, how they are made to feel in the office, how effectively the staff manages business aspects such as billing and insurance, psychological reactions, anxiety and fear of pain, dental phobia, physical and mental needs, and financial strain. Meeting the patient's needs could include having a positive atmosphere, sincerity, showing respect, respecting the patient's time, resolving complaints and misunderstandings, remaining approachable, and respecting patient confidentiality. Telephone skills include etiquette, how to manage incoming calls, outgoing calls, dealing with difficult calls, placing callers on hold, and how to manage callers who want to speak with the dentist, and then taking messages. The phone is your most important piece of equipment used in public relations. Messaging systems could include your voicemail, the answering machine, an answering service, text messaging, email, and teledentistry. Written communications could look like business letters. These are letters to colleagues, letters to insurance carriers, format of a business letter, an anatomy of a business letter, and preparing envelopes for mailing. With marketing your dental practice, you want to remember the goals, the logistics, and then the type of advertising, website, blog, social media, health fairs, newsletters, brochures or flyers, thank you gifts, and also birthday greetings.